Teleflex is proud to partner with clinicians, patients, and organizations worldwide to develop products and educational solutions designed to help protect patients and providers against healthcare-associated infection. We offer the Aero Evolution with Chloriguard technology, AeroGuard Blue Plus, and the ErgoPack system. Each product is designed to provide clinical benefits and enable healthcare providers to improve outcomes, enhance safety, and reduce healthcare costs. Product demonstration in this video is demonstrated according to the manufacturer's instructions for use. This does not indicate appropriateness of the procedure for any particular patient. Product available by physician prescription only. Prior to use, read all package insert warnings, precautions, and instructions. Failure to do so may result in severe patient injury or death. Follow your institutional protocols where appropriate. This product demonstration is for the Aero ErgoPack system. This ergonomic packaging system for vascular access procedures was designed to efficiently facilitate compliance with best practices, evidence-based medicine, guidelines, and recommendations from organizations to reduce the risk of central line-associated bloodstream infections. The ErgoPack elements are organized to coincide with the order you follow to execute the procedure. This human factors design is intended to address gaps in sterile procedure. It also promotes standardization of aseptic technique for all vascular access procedures to reduce the risks of CLABSI. The lid stock lists all of the components within the kit. It also features shadow graphics for at-a-glance recognition of the kit components. The lid stock also features a hang tab clearly displaying the catheter features, both in the pictogram image and detailed listing, including the catheter type, French size, number of lumens, length, and special indications such as pressure injection of contrast for CT procedures and antimicrobial protection when applicable. Attached to the lid stock is a pouch containing items to support best practices such as procedure checklists, instructions for use, and patient education materials. The first item in the pouch is a sterile procedure stop sign. Simply hang this on a doorknob or attach it to the curtain in a patient's room to prevent disruptions to the sterile procedure. There are two checklists included in the external pouch of the ErgoPack: the clip list, as recommended by the National Healthcare Safety Network, and a compendium version based on a combination of recommended elements to reduce risk during intravascular catheter procedures above and beyond CLABSI prevention. If you're inserting a pressure injectable catheter, the system will come with a pressure injection log to use to track CT injections and provide information about the catheter's performance parameters. Add this information to the patient's record for the CT department in the event the patient requires a pressure injection during the dwell of the catheter. The rest of the product-related literature is contained within the pouch for your reference. The ErgoPack contains sterile saline flushes on the outside for the tray. These can be dropped onto the sterile field later in the procedure. Before performing any medical intervention or procedure, the patient ID should be verified using two forms of confirmation. Obtain patient consent for the procedure and document consent according to your institutional protocols. Prior to prepping the patient, utilize ultrasound to assess vessels and determine optimal insertion location based on vessel health, vessel-to-catheter outer diameter ratio, and other patient factors. Wipe down any surfaces that you will use for the sterile procedure, including the adjustable table, bed frame, and ultrasound unit. Begin the procedure by peeling back the lid stock on the ErgoPack system. Grasping the bundle where it is taped, remove it from the plastic tray. Place it on the bedside stand. Remove the lid stock and record the lot number on the checklist and any other required locations based on your institutional protocols. The external plastic tray can be placed aside for recycling. Remove the yellow tape and open both flaps to reveal the first layer of the ErgoPack system. The blue wrap establishes the sterile field. Additional layers will re-establish the field as you proceed through the system. The first layer contains a bouffant cap, a mask with an eye shield, and a 3 ml highlight orange ChloraPrep sponge. Take the mask and place it over your ears. Adjust the mask for proper fit over your mouth and facial hair. The eye shield on the mask is fog-resistant, but if you already have eye protection, the eye shield can easily be removed. Remove and don the head cover. Be sure to cover your hair completely. Place head cover over all visible hair. Wash your hands and put on gloves. ChloraPrep is 2% chlorhexidine gluconate in isopropyl alcohol solution. Highlight Orange ChloraPrep is included in the ErgoPack system to provide optimal skin prep and visual identification of the prepped area. Crack the applicator open by squeezing the wings. To activate, pinch the wings on the applicator to break the ampule and release the antiseptic. Do not touch the sponge. To wet the sponge, repeatedly press and release the sponge against the treatment area until liquid is visible on the skin. In dry surgical sites such as IJ or subclavian, use repeated back and forth scrubbing strokes of the sponge for about 30 seconds, or until the treatment area is completely wet with antiseptic. Allow the area to air dry completely for maximum effectiveness. This will take approximately 30 seconds. The next layer provides a surgical gown and sterile hand towel. The sterile hand towel indicates time to perform hand hygiene again. Use the sterile hand towel in the next layer to pat your hands dry. The gown is laid out so you can slide into the sleeves with ease. Keep your hands inside the cuffs of the gown to maintain sterile technique. An assistant will need to attach the Velcro on the back of the gown. Allow the assistant to grab the hang card and tie the cords in the back. Don gloves using proper sterile technique. The next step is draping the patient. Open the last layer to reveal the head-to-toe drape. The drape has a 4-inch fenestration window with an 18 by 18-inch clear window so that it is easy to identify anatomical landmarks. Fold in half and peel back the adhesive around the fenestration. Align the fold to the targeted prep area for insertion. There is a system of 4 to show how to use the drape. Orient the drape using the arrow and head references appropriately on the insertion site. Start by pulling the first arrow out to the right. Then pull the second arrow to the left. Pull the third arrow toward the head of the patient. Finally, pull the last arrow toward the feet of the patient to fully deploy the drape. The sheet over the insertion site allows you to secure the adhesion around the fenestration without contaminating the insertion site. Be cautious not to touch the skin. At this point, have an assistant drop the sterile pre-filled syringes into the tray. Pick up your catheter and remove the dead-end caps. Begin flushing each lumen with the saline syringes. Lock each lumen with the blue slide clamps to ensure that the saline does not empty from the catheter. Place the catheter back into the tray for later use. Next, use a 4x4 inch of gauze and crack the ampule of lidocaine. In accordance with JCO guidelines, place the lidocaine label on the syringe to identify the medication. Anesthetize the insertion site by performing a skin wheel. When complete, lock the needle's safety mechanism and place it into the tray. Perform line insertion using ultrasound. Identify the vessel noting size, patency, and associated anatomy. Using the Rollerson syringe, a closed system for vessel access and wire insertion, and the echogenic tipped needle, puncture the appropriate vessel. Once the vessel is visually accessed, aspirate blood to ensure cannulation. If necessary, advance the needle another millimeter and verify return again. For further confirmation of venous placement and to rule out an arterial cannulation, use the pressure transduction probe. Remove the green cap and insert the probe into the rear of the Rollerson plunger and connect to a pressure transducer. Ask the assistant to document pressure on the checklist and/or to archive the waveform if possible. Remove the transducer assembly and take the spring wire guide from the tray. Pull back on the wire for easy access to the back of the Rollerson syringe. Place the wire in the back of the syringe and push the wire forward using the Ergo Advancer. Advance the wire until you are sufficiently in the vessel and remove the Rollerson syringe and needle. Use the dilator to prepare the insertion tract for catheter placement. Advance the dilator in a rotating manner, expanding the tissue. If necessary, make a skin nick with a safety scalpel. Pull back the blade and place it back into the tray for later use. Place the wire tip in the distal end of the catheter. Unclamp the lumen of the distal lumen port. Advance the catheter into the skin. After the catheter is advanced to the desired position, use the sterile saline flushes to aspirate and flush each lumen to ensure patency. Secure your catheter based on institutional protocol. To allow improved access to the catheter during securement and dressing, the fenestration can be increased by tearing away. Place the biopatch around the catheter at the insertion site with the blue printed portion facing up. Twist it with a half turn so the slit is at 3 o'clock from the catheter. It should completely surround the catheter to provide effective catheter insertion site protection from infections. A sutureless securement device is the least invasive option with demonstrated reduced risk of infection and effective stabilization. It should be chosen with consideration for securement location and patient variables such as body hair or diaphoresis. Using the needle driver with the curved suture, begin suturing the catheter to the skin through the suture wings on the catheter. Reuse the safety scalpel to cut the sutures. Once you're done using the safety scalpel, pull back the blade until it locks. As a final step, place the Tegaderm dressing over the insertion site. Use steri-strips to add additional securement to the dressing and catheter. Document your initials and date on the dressing. It should completely surround the catheter label, following your institutional protocols. Once the catheter has been secured and dressed, use the easy tear-away feature of the drape to remove it from the patient. It is designed to be removed without the need to cut it and to avoid tugging on the catheter lumens or dressing. Confirm catheter tip position is in the lower 1/3 of the superior vena cava, or cavo-atrial junction per institutional protocol. The system is designed to make cleanup easy and environmentally friendly. Dispose of the sharps in the appropriate container. Place the tray and any other contaminated elements from the procedure into the biohazard waste container. Place Tyvek and plastic waste into trash. The outer tray and papers not contaminated by the procedure or used for documentation can be recycled if supported by your institution. At any time during the procedure, aspirated blood or contaminated fluid can be sequestered away from contact by placing them into Ergo's HemoHopper container. This blood and fluid containment reduces the risk of bloodborne pathogen exposure during and post-procedure. During the procedure, dispose of the used needles in the Sharps Away 2 locking cup for secure disposal. Thank you for taking the time to learn more about the ErgoPack system. Teleflex is proud to support your efforts to comply with established guidelines and to help you protect against infection and improve patient and provider safety.